Good morning, good afternoon, good day, everyone, and welcome to our webinar, Health Taxes to Funding Crisis. We will give a few seconds to everyone to enter the session, and we will start very soon. Thank you for joining us today. As I see that the number of participants is rapidly increasing, we will start. So again, welcome. More than 250 people have registered to join us and our panelists today, so thank you for your interest in that topic. Let's start by some introduction and framing. We will then proceed to the panel discussion and make some time for questions and answers with the audience at the end. Feel free to write your questions in the Q&A section during the session. My name is Lucie Lermont, and I will be your host for the hour. My organization, Global Health Advocates, is an NGO leading advocacy to fight global health inequalities worldwide. Our action is directed towards the French and European institutions, as well as towards international institutions operating in the development sector, in particular global health and its financing. Over the years, we have monitored the evolution of the global health needs, influencing with our partners the international community's response to them. And like all of you, we've witnessed the decrease in official development assistance for health, while human needs persist and to some extent increase. To name only a few of the harshest realities, child survival gains have stalled significantly since 2015, and hunger has increased for the 6th consecutive year in 2025. In the meantime, recent cuts to the USAID may lead to more than 40 million additional deaths by 2030. In parallel, more and more countries issue a clear and strong call to reform the global health architecture by reinforcing health sovereignty while strengthening international solidarity. African countries have taken a stance in this regard through the Lusaka Agenda, or more recently the Accra Reset, for example, emphasizing the need for alignment of global health partners behind national priorities and stronger domestic systems. So the conclusion is clear. Additional sources of funding are needed to answer to these challenges. And the good news is that interesting mechanisms already exist, such as the one we will explore together today, health taxes. Indeed, a study by the Center for Global Development shows that if all low and middle-income countries increased taxes enough to raise prices of tobacco, alcohol, and sugar-sweetened beverages by 50%, they could raise more than $2 trillion over the next 5 years, equivalent to 180% of ODA. Allow me to share one last point of context before presenting our speakers. Against this backdrop, the Africa Forward Summit will be held in Nairobi, Kenya, in May 2026, to find solutions to issues of common interest to the African continent and France. This webinar's objective is to explore the potential of health taxes as one of the solutions, at least for the health and development sectors. And so to explore this issue, we have the privilege to receive 5 distinguished guests. Dr. Adam Karpathy, Senior Vice President of Vital Strategies. You are joining us from New York City in the United States. Welcome. Ms. Jeren Ozar, Manager of the Global Tax Program at the World Bank. You are also joining us from the United States, but from Washington, D.C. Welcome. Mr. Lindstrom Marangu, Tax Specialist at ATAF, the African Tax Administration Forum. You are joining us from Praia, Cabo Verde. Welcome. Ms. Agnès Souka, Head of the Health and Social Protection Division of the French Development Agency. You're joining us from Paris, France. Welcome. And Dr. Patrick Olomo, Head of Economic Policy and Sustainable Development at the African Union Commission. You are joining us from Addis Ababa, Ethiopia. Welcome. So turning again to you, Adam. You have more than 20 years of experience, leadership experience in epidemiology, programs, emergency response, and policy. At Vital Strategies, you oversee teams working in dozens of countries to strengthen public health systems and address leading causes of death, illness, and injury. And Vital Strategies is known for having implemented comprehensive campaigns to both build public support and help sustain political will around health taxes. So I am now giving you the floor for your opening remarks on the potential of health taxes.
Thank you very much, Lucille. Good morning, good afternoon, and good evening, everyone. As Lucille mentioned, I'm Adam Karpati, Senior Vice President of Public Health Programs at Vital Strategies. Thanks to Global Health Advocates for the opportunity to be here today, and I feel privileged to join such a distinguished group of presenters. Indeed, Vital Strategies is a global public health organization. We have a large program of work around supporting governments to implement health taxes and work in partnership with governments and civil society. So as an introduction to today's discussion, I'll just briefly talk about why health taxes are such an important strategy for health and development and some considerations of how to promote more widespread and robust implementation. Health taxes, of course, refer to specific excise taxes on unhealthy products, most commonly tobacco, alcohol, and sugar-sweetened beverages. Consumption of these products contributes to millions of deaths every year globally, predominantly from so-called non-communicable diseases, NCDs, such as heart disease, cancer, diabetes, and lung disease, and in the case of alcohol, from injuries and violence as well. The burden of NCDs is substantial and growing in Africa and affects not only individuals and their families, but puts increasing strain on healthcare systems as well. In Africa, tobacco contributes to more than 200,000 deaths annually, and alcohol more than 300,000 deaths per year. And there's strong scientific evidence that raising the price of unhealthy products via taxation leads to decreased consumption and reduced harms. This is reflected in the World Health Organization identifying health taxes as among the most effective interventions available to governments for reducing NCDs, and WHO recommending that all countries adopt this intervention. Furthermore, decreased consumption associated with health taxes also relieves stress on the healthcare system. And while delivering these results, health taxes also generate revenue for governments. So this is the triple win of health taxes: saving lives, reducing healthcare costs, and raising revenues for public good. The Task Force on Fiscal Policy for Health estimates that raising the price of tobacco, sugary drinks, and alcohol by 50% worldwide through health taxes could prevent 50 million premature deaths over 50 years. And as Lucille mentioned, the revenue generation is substantial. Trillions of dollars in tax revenue worldwide could be raised, with more than half generated in low and middle income countries, enough to cover 40% of health budgets. An important consideration is that most countries in Africa already have some form of health tax already in place. But the challenge is, with some exceptions, the rates are simply too low to affect consumption. And moreover, the design of these taxes is often not optimal, reducing their effectiveness. For example, WHO recommends that excise taxes should represent at least 70% of the price of tobacco, yet only one country in Africa, Mauritius, meets this minimum threshold. Similarly, if taxes are not indexed to inflation, their impact can wane over time. Yet for alcohol, only 1 in 4 countries in Africa index their alcohol taxes to inflation. So that said, there are examples across the continent that we'll hear about today of countries that are moving towards best practice implementation of health taxes, including Mauritius, with strong tobacco and sugary-sweetened beverage taxes, South Africa's health promotion levy, which raised $300 million in the first 2 years after adoption, Botswana's alcohol taxes, Cabo Verde, Ethiopia, Ghana, and others, countries that are generating substantial revenues and saving lives at the same time. With the passing of the political declaration at the recent United Nations high-level meeting on NCDs and mental health, which includes health taxes, momentum for the importance of this strategy is growing. G7 Africa cooperation can be a powerful force for advancing the health tax agenda. France and other G7 countries can promote this proven strategy and support partner countries in a variety of ways by providing best practice examples of tax rates and tax system design, supporting and convening the essential intersectoral government collaboration needed to develop and implement health taxes with the critical participation of ministries of health and other sectors along with finance ministries, supporting the involvement of civil society as critical contributors to tax initiatives, building popular support and endorsement from a diverse set of constituents, and recognizing that industry interference and misinformation often impedes progress and must be countered. In short, health taxes are close to an ideal public policy in their benefit for both public health and financing, made even more compelling by the fiscal and health pressures affecting countries across Africa. When developing a health tax strategy, rates must be high enough to meaningfully affect consumption, and tax design really matters. Rapid progress is possible. There are countries leading the way, and momentum is growing for all countries to embrace this life-saving strategy. I look forward to hearing the rest of this robust conversation. Thank you very much.
And thank you, Adam, for this very compelling overview, recalling the triple win of health taxes, but also some of the challenges still lying ahead. But I want to remember that the momentum is growing and that the G7 this year is a real opportunity to advance this issue. And so thank you again. And I will now open the panel discussion. So with you, Jerem, by managing both the Global Tax Program and the Platform for Collaboration on Tax at the World Bank, your work focuses on strengthening multilateral collaboration on tax issues and advancing the Taxation for Development agenda. Considering your key role, I would like to ask you this question. The World Bank support countries in reforming their health tax agenda. What key lessons do you draw from this experience?
Thank you, Lucille. Great question. It's a pleasure to join this discussion with such a distinguished group, and I look forward to questions from our participants as well. As you rightly mentioned, Lucille, on average, so we support countries on domestic revenue mobilization, which is very core to development. It's at the, I think, heart of development because with rising debt burdens and shrinking official development assistance, as you highlighted, taxation is central. In fact, some of the colleagues who are listening in may have heard that we're using this benchmark of 15% of tax to GDP as a sort of a rule of thumb to get the basics in place in terms of human development, supporting service delivery, and igniting growth in countries. And unfortunately, a good number of countries are below that benchmark, especially a good number in Africa. So the needs are greatest. So our work on health taxes is very much embedded to our overall work in supporting our developing countries in improving domestic revenue mobilization, both with tax policy and tax administration. And we have a particular focus in Africa where the domestic revenue mobilization needs are often the greatest. On average, I would say we support about 30 countries with different elements, either on tax policy, tax administration, sometimes a combination, specifically on health taxes alone. And our work often integrates to the broader tax system related dialogue, whether it's on the diagnostic level or it's related to our concessional lending programs, which allows us, I think, to leverage both our partners and our work and our country teams' work. I think the health taxes, it's really important to emphasize that the case for them and their impact is both clear and very compelling. Let me start with why. We said that with rising debt burdens and shrinking ODA, taxation is central to development. It's central to development because it helps raise domestic revenue, especially in the context of declining external support. But it's also important because it shapes behavior. It can push people toward healthier behaviors and habits. But it's also very important for a third reason that I think perhaps connects to the revenue use discussions. It can help strengthen the social contract between a government and its citizens. And excise taxes on tobacco, alcohol, and sugar-sweetened beverages, when done right, do all of these three. Let me start with the behavior change function, and Adam already started thinking about this. This behavior change function of excise taxes is strongly underpinned by a robust economic rationale. Health taxes align private and social costs. They correct, as we economists call them, negative externalities. So, for instance, secondhand smoke, drunk driving risk, public treatment costs with increasing prices, and that price signals impact on the behavior change. It helps basically reduce this cost. But you may be asking, What about something like sugar-sweetened beverage, sugary foods? How is that, creating a negative externality? There, we economists talk about negative internalities. That is, today's choices that harm our future selves. And this is really important. If you think about it, drinking cheap sugary drinks as a kid, as a child, with no nutritional value today, leading to diabetes tomorrow because of imperfect information, limited self-control, and what we call present bias. For Seinfeld fans in the room, the night guy basically putting the morning guy in a bind is a good example of internalities. So my key message is economic rationale is very strong, and that's why the World Bank is very active in this area, supporting our ministries of finance. But it doesn't stop there. Health gains for individuals and society as a whole, lowering public spending, and also at the individual level, increasing by improving health, increasing productivity and human capital, and households basically allowing more space in their budgets to invest more in their children, people living longer, healthier, more productive lives. Okay, so with that, let's move to this slide. Thank you. Excise taxes from tobacco, alcohol have a significant scope to increase in Africa. According to our calculations, on average, high-income and middle-income countries and low-middle-income countries are not very different from each other. Tobacco taxes alone can raise 0.6% of tax to GDP. And this is with not so great tax design. Even then, it's a significant number. In sub-Saharan Africa, the number average for about 15 countries where we have data is about 0.2%, 0.23%. So there's quite a lot of room. And as Adam was emphasizing, there's quite a lot of variation among African countries. Mauritius is a great example of success. And some countries where still tobacco, alcohol, and sugar-sweetened beverages use is somewhat high, but because of maybe a potential to improve tax design, still the gains are not there yet. But we are seeing significant interest, and I think Lindstrom will talk about that as well. So let's move to the next slide. Wonderful. Why it is important to emphasize the value of putting significant focus on health taxes in Africa, because the health problems will not go away. If anything, I think our expectation is unless treated holistically, including health taxes, but other measures as well, we expect, and also this is the private sector estimates, all of these product sales are expected to increase quite significantly. So cigarette sale tax in Africa, according to Euromonitor, are increases to expect at least by 9% just by 2027 alone. Alcohol sales are expected to increase very significantly by 25%, and sugar-sweetened beverage sale taxes as well. Adam was, I think, very aptly describing the NCD consequences of that. So I have some expected numbers unless, action taken on mortality and morbidity of these expected increases in consumption. Well, as we said, health taxes are still underutilized in many African countries. So this is not destiny. This is not fate. It can be changed. In fact, we see increasing number of African countries implementing health tax reforms with meaningful fiscal and health revenue benefits. So next, I'm going to be talking about that. Kindly, if you can move to the next slide. I'll start with a very uplifting example from where Lindstrom is right now, Cape Verde, where following reforms that follow the ECOWAS Tobacco Tax Directive, Cape Verde added specific tax to cigarettes and increased ad valorem tax in 2019. Incredible impact by basically annual increase in the average tax per pack of cigarettes increased more than 400%, leading to 355% in tax revenue. A specific tax was implemented. Adam was earlier talking about the importance of tax design and structure. So specific tax really addresses and also reduces the incentives to switch to cheaper brands. That was implemented for alcohol in 2022. That increase led to a 39% increase in the tax revenue. All in all, this is, I think, very impactful for us who are working in the tax field. Tax reforms are difficult. They're politically challenging. We talked about 15% tax to GDP. There are not a lot of places where you can get quick gains of increasing 0.5%, 1% of tax to GDP in 5 years. Well, this country got that with health taxes. Large increases in tobacco and alcohol tax revenue were observed. In fact, the revenue rose from 0.6% of GDP to 0.9% just within a 5-year time frame. Next slide, please. Now, here's another very positive example from Rwanda. Rwanda was earlier applying a tax to, let's say, a low base, like really early in the supply chain. They basically made a reform that allowed them to apply the excise tax later in the to retail price and then increase the rates as well. That led to a significant increase just in the first year alone. The price of a pack of cigarettes increased about 52% on average, leading to a 38% increase in tax revenue. Well, since reforms were introduced, tax revenue overall for health taxes increased from 0.9% to 0.11%. You can say that's insignificant, but without these reforms, actually the revenue would have declined. So it's important to note that. Next slide, please. Now, one last example is Nigeria. There has been significant reforms in Nigeria as well. Between 2018 and 2023, Nigeria achieved substantial gains in excise revenue, with collections from tobacco and alcohol rising almost 274% in real terms. And that number is even higher with the new tax on sugar-sweetened beverages. While excise taxes still amount to a low, tax to GDP, this represents meaningful progress for the country because it accounts for almost 8% of the increase in tax revenue, where overall government revenue remains very low and very important for the country. Next slide, please.
Thank you for these examples, Jeren. If you can wrap up soon.
Yes. I just want to list the number of basically the countries we work in Africa in case any of the participants have questions or want to engage with me later. And I think we'll share these slides as well. Next slide. Okay, so the considerations. Good tax policy design is essential. We've seen this from the 3 examples. Indexation is really important in the case of Nigeria, unless, for instance, the inflation already watered down some of the impact that we observed in the earlier years. Strengthening revenue administration is extremely important. Usually illicit trade is being put forward as an excuse for not pursuing health tax reforms and more aggressive health tax related rate increases and tax policy improvements. But what we often see is that illicit trade is more linked to weak governance and weak enforcement issues rather than high rates or a good tax policy design. For civil society colleagues and any government related officials who might be with us today, it's really important to emphasize that the reforms need to be anchored to data-driven and evidence-based approach with modeling. And then public support can be strong, but it needs to be leveraged thoughtfully. And what I mean by that is countries need to do basically meaningful reform so that the tax policy reform dialogue in the country shows an impact. So they don't lose out their credibility by, let's say, pushing a legislation and not implementing it. And ultimately, what matters is how health taxes shift behavior, improving health, human capital, and equity over time. So don't focus too much on the very static counter arguments, let's say job losses or regressivity. And I think there's a lot of good high quality analytics and country level analysis to counter these arguments. I'll stop there. Thank you.
And thank you. Thank you very much for, in the end, reminding us that health taxes represent clearly an untapped potential, especially considering that sales on these unhealthy products will increase, as you said, and how easy it seems to be to put in place. And thank you also for the counter arguments that you presented to us to counter the excuses not to pursue tax reforms. Lindström, happy to have you with us. You provide expert support and advice on health tax policy development and implementation to African governments. This includes various areas, including domestic and international health taxation, as well as curbing tax evasion, and to contribute to the social and economic development of Africa. So my next question is for you. Your organization, ATAF, is formed of 44 countries willing to align and better coordinate on tax issues. In your opinion, why is health taxation a priority of African governments?
Thank you very much, Lucille. I hope you can hear me clearly. Excellent. And thank you as well to my previous speakers. Could we fully associate ourselves with your comment, your opening remarks, the comments by Dr. Adam, and the presentation by Sharon, because it does provide some very important context of the work that we do and why we think it's important here at the African Tax Administration Forum. So straight away go into the responding to the question, and probably if you could move to the next slide. The next one, please, because of time. This is, you can just move to the next one. Thank you very much. Yeah. So I just want to add probably an important context. I know part of this was mentioned by Dr. Adam when he made his opening remarks. But in Africa, we find ourselves in the middle of some significant crises and some significant challenges. And if we don't implement significant reforms, whether you're talking about reforms in health taxes and some of the other areas that we are working on, then African governments are likely to face significant challenges funding issues, critical issues like healthcare, education, and some of the other development needs of the continent. So if you look at these numbers, we are looking at a gap of about 6.4 trillion by 2030, and this is just to fund the SDG that we've committed to. So a significant gap over there, infrastructure gap, about 2.2 to 2.5 trillion. And this is a significantly big figure that as a continent, we need to figure out where do we get these resources to fund these significant challenges. And we also have illicit financial flows that are, again, remain a significant, huge challenge, but over 80 billion leaving the continent in some form of illicit financial flows, which again sort of amplify this challenge that we have of funding serious issues in the continent. And move on to the next slide, please. And these are all issues that we have to critically look at when we are examining the context of where we are today. Now, if you look at probably in the last decade, what has happened in Africa is a significant portion of the funding in Africa is coming from taxes, which is not a bad thing because means that we are moving towards dependency in revenues, which is a good thing. But the revenues are not sufficient and they're not coming in as in the amounts that we need them to be able to fully fund some of the key challenges that we have. So if you look at these figures all the way from 2020 to 2023, is that then significant reliance on revenues is continuing to grow, and we are likely to see this continuing to grow in the short term, in the long term, as ODA declines and some of the other key issues that we just mentioned in this particular conversation. Move to the next slide, please. So if you look at the next slide, what we noticed again, this is not necessarily a challenge unique to Africa. It's a challenge that cross-cuts quite a number of developing countries, is tax to GDP ratios are stuck at around 15%. You can go back, please. So if you look at tax to GDP ratios being stuck at around 15%, it's a huge challenge because we need to be able to raise this to some significant figures. If you look at OECD average, for example, you're talking about over 30%, which means then we are not collecting enough to be able to fund whether you're talking about development or some of the other critical needs that we need to be able to fund. So at ATAF, we are looking at how do we support countries be able to move from this 15% to raising significantly more resources so that then we are able to fund the important issues that mean a lot to the African people. And that's why health taxes come in. And of course, health taxes alone may not necessarily cover this gap, but they play an important role in terms of addressing this significant gap. We can move to the next slide, please. So if you look at the next slide, it shows us why ATAF specifically then has focused, please go back, why ATAF has then decided to look at health taxes as one of the key areas of support for African countries. As I mentioned before, and I think Dr. Adam already mentioned this, NCD burden is rising in Africa. We have a serious debt crisis in the continent. When you're talking about a significant portion of the budget going to just interest payments, and that becomes a big concern, and the numbers are there. We can share this with the participants. Declining ODA, everyone is aware that in many African countries, ODA and has been funding a significant portion of the ministries of health funding. In some countries, around 60%, which is quite significant. So the decline in ODA does affect people's lives directly. And those of us who are familiar with the African context, is we have a declaration which we call the Abuja Declaration, where every member, many African countries have committed to allocating 15% of their budget to health. And if you've been monitoring and looking at these numbers, very few countries have been able to do this in the past. And again, because of the development challenges and the low tax to GDP ratios that we continue to experience. So when you put all these issues together, then African countries have to figure out solutions for how do we make sure we get our countries to significantly depend on themselves. And therefore, health taxes become a significant portion of the solutions that we have. We can move on to the next slide, please. I know that Sharon, in our example, shared quite a number of what is happening in the continent, what is working and what is not working, and I will share probably just one more example. But we are seeing that there is significant potential. If you look at these key three products, we are talking about probably the potential of raising around 3.7 trillion in revenue over the next 5 years. And around 2.1 trillion is coming from low and middle income countries. So if we do effectively implement health taxes on the three products, that's alcohol, sugar, sweetened beverages, and tobacco products, there is potential for additional resources and additional revenues that will be critical. So if you look at Africa, for example, this publication is by the African Tax Administration Forum, which is called the African Tax Outlook. It's available, and we could share it as part of the documents you're sharing with the participants. Excise taxes tend to contribute around 8 to 10%, which is not small amounts. A lot of this revenue comes from tobacco. A lot of this revenue is coming from alcohol, and a significant portion of it is coming from fuel. So there's opportunities for us to optimize a lot of these taxes and increase these revenues significantly, even as we look at saving lives, as we've discussed previously. Let's move to the next slide, please. So what are we seeing happening in the continent? And I know Sharon has shared a bit of this, so I won't repeat it. In as much as yet there is slow progress, but we are seeing some progress. Over the last year, for example, we've seen quite a number of African countries implementing significant reforms. Countries like Morocco, Mauritius, which is one of the best examples, Comoros, We've seen South Africa, Kenya, Senegal, Zambia, and I could go on and on. There are many, and this we're talking about reforms between 2024 and 2025. And these are just a few examples. If we had time, we could probably discuss more about some of the other countries as well. And some of these reforms, the ones I've highlighted here largely touch on tobacco. But when you go to the other products, sugar sweetened beverages and alcohol, there are quite a number of reforms that are happening across the continent. So there is movement, there is growth, there is improvements. Are we where we should be? Not yet. So there's still a lot that needs to be done, but there is progress, although it's not as fast as we'd want it to be. But we are glad some countries are progressing, some countries are stuck, and these are challenges that we have to deal with, and we see which countries then we need to support moving forward. Please move to the next slide. So I know that Sharon shared some good examples from Nigeria, from Rwanda, from Cape Verde. And I just wanted to add one more example here, which is Ghana. So Ghana has been one of those countries that have taken their reforms, specifically around tobacco taxes, very seriously. And not just taxes, the whole package around, tobacco tax controls and some of the other measures that are recommended for making sure that we reduce consumption of tobacco in the country. So I'll just share the revenue aspect, but I know there are many other things that Ghana has done right that we could talk about. So if you look at these numbers, and these numbers are available, again, shared by the Ghana Revenue Authority, you can be able to see them. Ghana has one of the lowest prevalence of tobacco in the continent. And this has been achieved intentionally using policy, health taxes, using some of the other policies as well. If you look at the revenue numbers, they have been growing consistently over years. And the numbers are shown here. The numbers available here for both tobacco, there are numbers for alcohol, there are numbers for SSBs. So if you look at tobacco, which is on the first column, you can see the growth of the revenues consistently. In 2023 alone, quite significant reforms implemented, and the revenues went up, and you can see the numbers here. And in addition to the examples given by Sharon earlier, there is a clear indication that health taxes work. They are effective, but they have to be implemented effectively and accompanied by effective tax administration to be able to do that. I know we could go on and on. We have many examples to give, but let me just move on to the next part as I conclude. Are there opportunities to scale this up in Africa? And I'm glad that Dr. Olomo from the African Union is here today to shed light also from the African Union, because we did have a meeting with the African Union and the entire continent last year, and I'm sure Dr. Olomo will talk about this. And yes, we see huge opportunities for us to be able to improve health taxes in the continent. But as Sharon mentioned, we have political barriers, and these are issues that we are alive to, and we need to address them. And we have to be very clear about our messaging. And I think it's something that we continue to refine together with the partners that work in this particular space. There is a lot of technical support work needed in the continent. And some of the partners, including the World Bank that is here, and some of the partners, some of whom are not here, working to support countries. And when we talk about technical support, we are not just talking about technical support to implement policy reforms. We are talking about technical support to implement both policy reform, tax administration reforms, as well as regional collaboration issues. Because if you implement policy reforms and the tax administration doesn't have the capacity to implement these reforms, then you would never achieve whether both the revenue goals or the health goals that you intended to. So these are key areas that we see still a lot of work that needs to be done. Strengthening the capacity of tax administration. When we look at many tax administration, we've seen significant gaps in terms of how they are dealing with the various building blocks of excise tax administration, for example. And these are issues that we consistently need to support countries to be able to do that. Regional harmonization. Now, if you look at the African context, for example, one of the regions that have done well in terms of making sure that they have some level of coordination is ECOWAS region. The ECOWAS region has a directive. Waemu region has a directive. Although the challenge is that the ECOWAS and Waemu directives tend to conflict to some extent, and these are issues that we need to harmonize. But most of the other regions don't have sort of a formal directive to guide implementation of these taxes. And we are currently discussing with the East African community around some of these challenges, SADC communities. So there are massive opportunities for us to be able to leverage the relationships within the regions to see how then do we scale up harmonization with these regions. And lastly, illicit trade. Illicit trade remains a significant challenge. This is not necessarily an African issue. This is a global issue, but nonetheless, that touches on Africa as well. And these are issues that we are supporting countries and figuring out how do we help countries address illicit trade. Illicit trade is bigger than tax administration. It requires you to strengthen tax administrations, requires significant intra-country coordination, and again, supporting countries and what exactly does that look like, because it requires coordination from tax administration, criminal investigations, intelligence network within the country. So these are all issues that we see massive opportunities to support countries in implementing. And Lucille, as I finish, key comment is, yes, we do have a crisis in our hands. And I think there's a famous saying that says, do not let any crisis go to waste. So we think it's an opportunity for us then to relook at where the opportunities are, and we think health taxes is definitely one of the key areas. As I finish, we do recognize again that health taxes alone may not necessarily address the significant gap that we are looking into, and that is why here at ATAF we are looking at several of the other areas as well, including health taxes, international taxes, domestic taxes, digitalization work streams, and sort of the all-comprehensive package of how then do we support countries increase their domestic resource mobilization. So thank you very much, and I think I'll stop there for now. And back to you.
Thank you very much, Lindstrom. Thank you for reminding us that health taxes are a key area of focus, and with actual evidence of that area to advance development in Africa. It's good to hear that we are seeing some progress and that many reforms are already implemented. And we remember your call that this dynamic should continue, and that collection, tax administration capacity should be optimized. Thank you very much. So Agnès, let me first recall your background. Since 2021, your role is to coordinate the French Development Agency's efforts to promote access to quality healthcare and social protection for all, reduce maternal and infant mortality, and build resilience to climate change. Before that, you led governance and health financing work at the WHO, advancing health economics, UHC financing, and health systems governance. You also served at the World Bank and at the Africa Development Bank, contributing to major development strategies and crisis responses, such as Ebola. My last question then is for you. France is holding the G7 presidency this year and is planning to convene the international community around the One Health Summit and the Africa Forward Summit. How can these moments help accelerate the advancement of health taxes globally?
Thank you, and thanks for organizing this event, which is really timely and also brings together people who know a lot about this agenda. As has been mentioned by previous speakers, this agenda is actually moving very fast ahead. And the point I wanted to make in response to your question is first to say that taxes and subsidies are two sides of the same coin. In economics, we easily call taxes negative subsidies and subsidies negative taxes. The first step when we talk about taxes is actually to removing the negative taxes, which are the subsidies. Subsidies for fossil fuel, agriculture, and fisheries exceed 7 trillion per year. That comes from a report from the World Bank, and that represents about 8% of global GDP. So that's really the first point I want to make. Then when we talk about health taxes, we also talk about health subsidies. And the fact is that today, some of these products that we are mentioning should be taxed for health and fiscal purposes are currently subsidized. There are today subsidies that go to products that are high in sugar, and there has been in the past, as some may know, subsidies that would go to the tobacco industry. So we always need to look at these two as these two together. When I mentioned 7 trillion subsidies, harmful subsidies, this is actually more than what governments spend all over the world on health. So when we talk about the potential of fiscal policies related to health to mobilize spending, that is actually the equivalent of what we already spend. So beyond taxes, the removal of subsidies, and I'll make a mention also of subsidies on fossil fuels and taxes on fossil fuels that can also be considered health taxes, in the sense that we know that the burning of fossil fuel contributes to air pollution and contributes to early mortality. So we have, in fact, a sense of not only a triple gain, but maybe a quadruple gain when we talk about taxes on fossil fuel that not only benefit health, bring funding to Treasury, but also contribute to the environmental objective, including mitigating climate change. So removing these subsidies is a critical step of the health financing framework of the future, particularly as the needs for domestic financing of the UHC agenda currently exceed resources made available by governments in many, or if not most, countries. So health taxes should be handled together with subsidies. We need to look at both positive and negative taxation and both positive and negative subsidies as the one fiscal agenda that is conducive to better health. The second point I want to make is that health taxes are also health interventions per se. When we talk about the triple win, basically we consider health taxes not only as fiscal instrument, but as health interventions per se that are part of health packages, because they shape behaviors, they shape markets, and they are part of the package of essential actions of promotion and prevention. And in this sense, the health taxes are part, for example, of the DCP3 public health package that is promoted for countries as the best buys they should to invest in. As we move on thinking about the future of global health and the future of health financing at time of crisis, health taxes are a part of the health agenda. They are the heart of the One Health financing agenda. Our experience with tobacco tax shows the importance of this fiscal instrument as part of a broader package that includes regulation of advertisement and information communication. So we are now talking about the investments in health of the future in a health financing agenda that focuses on current and future challenges. And the question of subsidies and taxes are at the heart of the question of the relationship between health and the environment, health and the food system, and should be integrated in all discussions related to One Health. Health taxes are also a very key element of the reform of the international finance in architecture. And it is very clearly outlined in the Paris Pact for Prosperity and the Planet, the 4 Ps that is championed by France and many other countries, that are outlining different strategies and ways to mobilize financing in a different way that would foster a better answer to the financing need of developing countries at the crossroad of the social agenda and the environmental agenda. More liquidities, but also more favorable conditions to the financing. That includes the cost of financing, the cost of lending in particular, the interest rates, but also the grace periods, the flexibility of this funding, and the strings attached to this funding. So the health financing agenda in this respect, more than ever, is part of a broader conversation about development financing, about public investments, and how to get the best value for money out of what we fund for health and what we tax for health. This is in this respect that France is supporting this agenda of financial the reform of the financial architecture and reform of the global health architecture that focuses on this new generation of taxes that are also behavioral interventions and contribute to the One Health and the Planet and Health agenda. So this is about health taxes, but it's also about environmental taxes, including carbon tax and other fossil fuel taxes and removal of fossil fuel subsidies. Why is it so? It's because it's a contribution to domestic funding, so that fills the need for domestic funding to grow. And that corresponds also to the new ways that we have learned can work in shaping behaviors, and particularly shaping the food systems and the food markets. So that is going to be at the heart of those discussions of reform of the financial architecture, as well as reform of the global health architecture. So first, with the One Health Summit that France will convene on the 7th of April in Lyon, where President Macron will invite several heads of state and heads of government to discuss how the world will organize itself to promote this new agenda for health, the One Health agenda, and the planetary health and planet and health agenda, and how this will be financed, with the question of health taxes at the heart of it, and the question of how these health taxes relate to the broader agenda of harmful taxes and subsidies. Second, by carrying this agenda into the discussions of the G7 in the development track, that will discuss the follow-up to the Sevilla development financing conference, and see how these discussions about how to finance more and better the countries in need for the SDGs and for broader developmental purposes in general can be accelerated by reforming the global financial architecture. And third, by discussing this jointly and in a mutually beneficial conversation with African countries, in Kenya in May, in which there will be a roundtable on health that will discuss health sovereignty, particularly on the production of medical products, but also the sovereignty on financing, linking it to the Africa reset and to the demand from the Africa Union generally to develop a new financial architecture that will serve the needs of Africa better than it does today, and foster better collaboration on the promotion of domestic financing. And this is really how this year we see an inflection of the global agenda, both in terms of financial architecture and global health architecture. Thank you.
Thank you, Agnès, very much for this overview into already the future, this year opportunities. And thank you for reminding us that health taxes are already health interventions per se that should be integrated into discussions related to One Health and the international financing architecture. To conclude already this future-shaping session, I would like to further present Dr. Patrick Olomo. As the 39th African Union Summit opens today, we are very grateful to have you joining us. You oversee the African Union Commission's work on economic research, domestic resource mobilization, debt management, investment policy, and the establishment of the AU's financial institutions. You are also a member of the G20 Africa Expert Panel, contributing to policy discussions on pathways to sustained economic growth across the continent. Patrick, the floor is yours for your concluding remarks on future pathways for collaboration.
Thank you very much, Lucille, and thanks to all the other panelists for so eloquently presenting the case of the health tax for Africa's future. What I want to say is firmly aligned with what we already heard, but I want to reinforce what we're doing on the continent. The first thing is that the traditional model of financing health is no longer sustainable, and we have understood it at the African Union, because we can see that external financing for health is declining abruptly, and that we are in a context where we have less ODA for financing health, and this calls for, a continental agenda for domestic resource mobilization to finance health. That is the reason why we convened in September last year, from 29 September to 3rd of October, we brought together ministers of finance of the African Union and central bank governors and health ministers to discuss the critical issue of how do we finance health in a context where we have reduced international support and where there is also a broken international financial architecture, as was highlighted by Agnes. And when you look at that financial architecture, you can see that the debt architecture that we have today is absolutely not in favor of investing in strategic sectors such as health and education. Because when you look at the amount of resources that our countries are paying, not to repay the debt itself, but to pay interest, you will see that it is an unsustainable process that is depriving our countries and the continent as a whole of an opportunity to invest in a strategic sector such as health. In that perspective, we, the African Union, have convened our ministers, and they have reaffirmed their keen willingness and political support to finance health with domestic resources, and they have pledged to, increase their budget by 15% target that is in the Abuja Declaration, to ensure that we are able to raise the resources that are essential in financing our health. But in that context, we have also seen with ministers that by taxing harmful products like tobacco, alcohol, and sugar-sweetened beverages, we can achieve a triple win that provides an opportunity, first of all, to generate essential domestic resources, lower the burden of preventable disease, and incentivize sustainable industry practices that are, aligned with the health strategy that we are deploying. This is why our African ministers have pledged and they have committed to remain seized of the matter and to make sure that we firmly tax those strategic sectors. And in this, we are viewing health taxes as an innovative tool that will allow us to increase our capacities in mobilizing domestic resources that are essential for financing health and financing broadly Agenda 2063. We are also working with our member states with the support of ATAF, TGNA, and other Pan-African institutions to ensure that we effectively fight against illicit financial flows that are depriving the continent of an amount of approximately $90 billion every year. So you can see that it is a continental context that is in favor of a strategic shift towards health financing, providing an opportunity for our member states to support this, continental shift towards sustainability. And that is also why we have, adopted what we call the Lusaka Agenda and the Accra Reset, which are two tools that are reaffirming Africa's commitment to sustainable and predictable health financing on the continent, because predictability and stability should be at the center of the continental overall strategy for health financing. Let's not forget that the continent is also experiencing a demographic shift, which is providing, if we look at the data that are available, that the continent will be home for 2.7 billion people in just 2 or 3 decades, which indicates that it is of strategic importance for the African Union to invest in health taxes. In that context, how can the international support be of importance to support this process? First of all, there is need for us to make sure that international support is aligned with the priorities of African-led and African-owned solutions as outlined in the Lusaka Agenda and the Accra Reset. This is important because without that alignment, we will have a broken system that will continue to pose significant challenges in terms of how we are addressing the challenge that we see on health taxes. Secondly, it is important to work with the international partners in investing in capacity building for digital tax administration and custom enforcement, which is essential to ensure that we increase our ability in mobilizing domestic resources. Thirdly and finally, and I would like to align with Agnes, it is important to reform the global financial architecture because the current financial architecture is not in support of strategic sectors such as health. It is important that we look at, as for instance, the debt architecture to see how we can better use debt to ensure that it is, used for concessional term and aligned to strategic priorities in health. In that perspective, there is need for us to look at innovative solutions such as the debt for health swap to expand rather than restrain our fiscal space, which is already limited. It was highlighted that the fiscal space is still reduced, but there are opportunities that we do believe we can use together in a comprehensive reform of the international financial architecture that will allow us to move in the right direction. That is what we do at the African Union. As you can see, we have already started shifting the gears forward. The time now for us is for implementation of the decisions that we have at hand and to make sure that we have an international accommodating financial architecture. Thank you, and over to you.
Thank you very much, Dr. Olomo. And thank you for reminding us, if needed, that health taxes are actually a strategy of strategic importance to the African continent, and that ministers of finance, of health, governors of central banks do confirm their political support to this reform. And thank you also for precising the international support that is needed, both in terms of fostering innovative solutions, but also on reforming the global health architecture and its financing. So we already are at the end of our session. Unfortunately, we won't have time for questions and answers, but we did note some very relevant, interesting questions in the Q&A. Rest assured that the dialogue will continue. We will make sure that you receive an answer some way or another. And so I only need now to thank our panelists for sharing their rich experience and practical solutions with us today. Thank you to all participants for joining this important discussion. As Dr. Olomo says, the time has come to accelerate the implementation of these health taxes, and we hope to see concrete decisions taken at the One Health Summit, at the Africa Forward Summit, and beyond, of course. To make this happen, we call on all stakeholders, governments, regional institutions, international institutions, civil society, to stay mobilized. And on this, I thank you once again, and I wish you a very good rest of the day to you all.